And welcome back, and we appreciate you staying with us here on Morning Live. Thousands of households have had their medical services interrupted during the lockdown, and others are finding it harder to access the healthcare system altogether. Now, according to the National Income Dynamics Coronavirus Rapid Mobile Survey, over 3,000 pregnant women have not visited health facilities for up to 2 months now due to the fear of contracting the virus. And some participants said that they are unable to access medication, condoms and contraceptives during this period. We discuss this now with Sasha Stevenson, who is the head of health rights at Section 27. Thanks so much for speaking to us. Welcome to Morning Live, Sasha.
Good morning, thank you.
So what are your initial impressions on this survey, and how accurate a reflection is it of the conditions within communities?
The survey certainly reflects what we've heard and what we've been seeing from other people, and is really obviously very worrying. If people are fearful of going to health facilities, if they're unable to collect the kind of medication that they need, then we really risk setting ourselves back in relation to the health outcomes that we need to see and that South Africa has been working on improving for so long.
So, Sasha, according to the survey, what are the main causes for these interruptions, one? And two, what is also some of the reasons behind the unavailability of certain products during this time?
Well, part of the problem seems to be fear of going to facilities. People are worried about exposing themselves to the coronavirus. And so people are holding back from going to health facilities. And really, we need messaging to ensure that people feel more comfortable and to go to facilities, that they know that they can go there safely. And also that there are alternative mechanisms of collecting the kind of medication that they need. We have a system at the moment that ensures that people are able to collect medication from places that aren't health facilities. And one of the recommendations of the NIDS-CRAM report is that program gets expanded so that more people are able to access more medication outside of health facilities. Another problem, though, is the global availability of some of this medication. We know that there have been interruptions in the supply chain for things like condoms, contraceptives, and even some medication globally because of lockdown in different countries. And so South Africa needs to be looking at ways to ensure that these products and medication are accessible to everybody, because we've got the biggest HIV program in the world. We've come so far in ensuring people are able to access treatment, and we need to make sure that we maintain those important gains that we've made.
Sasha, what are these other avenues that you are alluding to where people could possibly go and access or fetch their medication outside of the usual primary healthcare facilities?
So the system is called CCMDD, and I'm not going to try and remember what the acronym stands for because I always get it wrong. But it's a system that people are able to register for within health facilities. They can, if they're stable on treatment, on chronic medication, they're able to register for this program. And then there are pickup points at different places across the country. So there are some lockers that are placed in different areas around communities where people will then be SMS'd told your medication is in this locker, here's the PIN code, and you can go and collect it. And then there are other places like pharmacies and spaza shops that have been appointed as pickup points. And so people can go to these places and collect the medication that they need without having to access health facilities, which obviously in ordinary times just decreases the congestion at health facilities, means that people don't have to go further than necessary to get their medication, and enables that easier access without having to go into a health facility. And those are the kind of programs that I think are important. But also we need to look at how we are integrating the COVID health response and other health responses. We need to ensure that we have an integrated system so that the health messaging and the interventions that are made are supportive both of COVID care and of other healthcare services.
Hamster in my head going wild at the thought of these lockers, Sasha, because as you say, during ordinary times, we hear of people being robbed of their ARVs, for example. So one would imagine that there would be a lot of thinking that goes into how you actually keep all of this secure and that people do in the end actually access their medication.
It is a really great system, and I think a lot of thinking has gone into it. It's been operational for a number of years now. The lockers aren't desperately widespread. Most of the medication is distributed through private pharmacies that then receive the medication from the state and can distribute, and through other mechanisms like support groups, etc. So the lockers are one example, but I think it shows what's possible when it comes to distribution of medication, that it doesn't always need to be in the clinic having waited in a long queue, and that really people are able to integrate their access to health services into their normal lives without having to spend such a long time waiting in clinics. So, as I say, that's one example of how we can make it possible for people to access medicine. But another is really trying to ensure that people feel comfortable to come to clinics, that they know when what symptoms they should be looking out for, to ensure that they do access the health services they need when they need it. Making sure people come to care when they need it is really very important, not just in relation to COVID, but in relation to health generally. And we need to be focusing on ensuring that people do have that access, so that the gains we've made don't get undone during this already very difficult period.
So, Sasha, who are most vulnerable at this stage when it comes to accessing healthcare services? And what are some of the risks that the lack of these visits to facilities could have for patients such as pregnant women, for example?
Well, I think pregnant women are a good example of an at-risk group. They're a group of people who need to access health facilities more frequently than the rest of us. And it's important that we ensure that they're able to do that, that they're able to go for their antenatal visits, that if there's a concern, they're able to access healthcare facilities. Another vulnerable group, particularly given what we've seen, that 23% of people reported that they weren't able to get their medication, including contraceptives, are women and young women. And unfortunately, that's always a vulnerable group. And we need to focus on ensuring that women, and in particular young women, are able to access the services that they need. We need to ensure that there aren't unwanted pregnancies as a result of this period because people are unable to access contraceptives. And so I think it's vital that we look at the COVID response and the health service response in an integrated manner, and we don't forget about the important other priorities that we have in the midst of a COVID response.
And Sasha, what about people with acute illnesses? What is government struggling with in this regard?
It seems that people with acute illnesses were more likely not to access health services when they needed to. So 22% of people who had acute illnesses and said that they thought they needed to go to a health facility, 22% of them said that they didn't go to that health facility. The number was much smaller when it came to people with chronic illnesses. And so that's also a group of people who we need to focus on. It's not just people who are collecting chronic medication, but everyone really who needs to access healthcare services. Other health issues don't come to an end because of COVID. And as I've said, we need to integrate those responses so that we're not moving back on some gains while we are while we've got a good COVID response.
What kind of strain would you say, in your assessment, did this pandemic actually bring about on an already strained national healthcare system?
I mean, I think there's huge strain that's been created by this pandemic. As we know, our health system is already under pressure. The public health system caters for 88% of the population. and is funded to the same extent as the private health system. So we already have a very strained healthcare system. We already have issues with stigma in relation to HIV. We already have groups of people who don't access healthcare services when they need to, particularly men and young men. And then you add COVID to the situation, and it just makes it so much worse. Government has spent a lot of time strengthening the healthcare system for the COVID response. What we need to make sure is that strengthening benefits everybody and not just the COVID response. It strengthens the health system generally so that the people of South Africa are able to access the healthcare services that they need and that are their right.
Sasha Stevenson, thanks so much for your time. Sasha is the head of health rights at Section 27, talking to us about access to healthcare services during COVID-19.